You're watching the Chris 6 News Back to School Town Hall, brought to you with limited commercial interruption by the law offices of Herman & Herman.
Welcome back, everyone. You know, we had dozens of questions like this one from David Meddy.
How are we going to ensure the safety of our children, you know, reassembling together and moving forward? So in order to reestablish that effective learning environment that we all count on.
Dr. Anjoum, as a pulmonary specialist, you have seen COVID and its effects firsthand. In fact, you're at the hospital right now. So the question to you as our medical expert, is it safe for our kids to go back to school in person?
I think that I'm not going to do the whole debate whether it's, important to open up and reopen schools. I think that's already established that this is something that as a nation, we need to move in that direction. But from a, clinical standpoint of view, we know that children less than 18 years of age, they usually experience very mild or sometimes, no symptoms at all in terms of COVID-19. And as compared to their adults, they are, much less likely to face any severe consequences from this infection. And I think we have a very good plan, as far as I have heard from everybody, in terms of reopening and always trying to see and reassess the situation and see if we need to fall back to remote learning again as compared to face-to-face learning. To cut the long story short, I think in terms of the infection rates, we do not see any significant problems with children getting affected by it and being very sick. But again, the risk of community transmission is something that looms at large.
But the risk is there. And that leads me to my next question. The big concern being teachers, staff, adults, like you were saying, Dr. Anjoum. James Davis writes in, I am a teacher. I have many, many friends that are older and all have some sort of medical issues. What's going to happen if they get sick? How are schools going to handle that? Also, Raul Garza asks, a lot of our teachers are in their 40s, 50s, 60s age range. What will be done to protect them as well as the students? And Charlie Flores says, what will school districts do when a teacher gets infected? I will open it up to the panel. Whoever wants to start first.
Well,
let me, if I could address that, because I think it may be a little easier in Fremont to address that than it is in Corpus Christi. We're limiting our in-person to 11 to 1. That will raise the odds in our favor of everyone practicing social distancing. We also have a very, very comprehensive response, recovery, and redesign plan that is very specific regarding if a teacher or staff member starts exhibiting symptoms, what happens next. And if they are quarantined, then we're going to protect those people. They're not going to be using any of their benefits while they're away from school. And then if we have a student that's at school and starts exhibiting high temperature, whatever the symptoms are, sore throat, we have an isolation area at each of our campuses until the parents can come and pick the student up.
Well, I wanted to say our teachers are very apprehensive, and rightfully so. This is a scary environment that we're in. And so if we don't practice what the CDC, what common sense tells us, that using a face mask, the social distancing, good hygiene of washing our hands on a regular basis, and not take any of that lightly, then I think we're going to be doing just fine when we open school with smaller environments. Let's be clear, smaller environments. But it's not only just to take care of our teachers, but all of the employees that are on that campus.
Dr. Cavazos, your school board just approved a 3% pay raise for your teachers, which is an amazing gesture, especially at this time. What is your district's plan when a teacher gets sick, infected? How do you deal with that?
I think many districts are using this a process map that outlines each situation that might occur. If there's symptoms but not positive, they're positive but no symptoms, etc. And so we have a step-by-step process for us to follow for each staff member. We also have a facilities response protocol that goes from level 1 to level 5 that helps us determine the amount, if we close a classroom, if we close a school, based on cases that are confirmed within the facility. So, we've, like the others, our employees are of utmost importance to us. And, our auxiliary staff have been working the entire time, since March 13th. They have been going in and cleaning and getting things ready this entire time and throughout the summer. And so, we are here to support them. But if the fear is very real for the adults, especially in this situation.
And Dr. Hernandez, what does that look like for CCISD? And also, will there be some way where if a teacher gets sick, they don't have to use their PTO? How does that look like?
We have a similar process. We have a flow chart that kind of guides our schools on what to do if those different scenarios happen. Of course, as mentioned by everyone, the safety is the most important for our teachers, our students, and all of our staff in the schools, and transportation, you named all of them. Regardless of what the case is, treating them all with urgency and making sure that we're following up with questioning who was in contact with that individual, our sanitizing immediately, like we would be doing, but then it would be an extra deep cleaning in that particular classroom or that particular area of the school, and then just making sure that we're adhering to all the health guidelines in place.
And that leads me right into the next question from our viewer, Joe Vasquez, who says, what happens when anyone in the classroom becomes positive? What's the protocol then?
I think immediately for all of us, it would be removal of the employee and then immediate questioning as to where they were in the school other than their classroom, who all they came into contact with, and then contacting those individuals as well and providing some questioning and going through the procedures that are in place, and then requiring that they quarantine or stay home for a number of days, as well as during the time that they're under the care of a physician. And then as far as closure, it would be closure of the class itself, maybe a particular area of the school. And I'm using examples from the full range of a veterans memorial with 2,000 plus students in one school, and then another campus that might have 300 to 400 students in a school. And that's where you're just going to have to assess, is it something we can do by containing and closing down one wing of classrooms, or does it require closing the entire school?
Will there be notices sent out if somebody tests positive? Will they be very clear in what happened, or will it be very vague because of HIPAA? We had one of our viewers ask that question.
Well, and so we're all in the same boat with that. To the extent possible, we're going to be very transparent and provide as much as we possibly can with nothing to hide, and letting our parents know exactly where we stand. We've also been doing that as a district over the summer. Many employees of the district who've tested positive, those are employees that aren't even at the district. But just sharing that information, keeping people informed, is what we would do during the school year as well.
Depending on the exposure, and just like Roland said, how much of the building does it affect? But Annette Rodriguez, the health director of the city of Corpus Christi, let me tell you, she's phenomenal. And she's a wonderful resource. And West also has reached out to her on a number of things related to the virus, and some do's and don'ts and suggestions. And I share that because that's great news to know in our community how well versed she is and is wanting to assist school districts in any way possible.
Yeah, I want to echo Conrado's point there. The last thing I think any of us want to do is turn into public health officials and make those type of calls that people with greater expertise, such as us, such as our doctor that we have here,
Dr. Anjum, right?
and the people in Alice who give us great information. We have got to rely on their expertise to make these tough decisions for each of our schools.
Dr. Anjum, after hearing what the superintendents have to say, anything that you want to say about their plans, especially if somebody's infected?
No, I think, I mean, it's a very promising to hear everybody speak about their plans, and very reassuring, I think, the way things have been outlined and all the plans are in place. I just sometimes feel a little sad and feel that it's tragic that we're having this conversation in United States, where we have multiple instances and examples of various countries across the world who have opened schools and they have not had any problems, just because I think, you know, their social distancing practices, hygienic practices, all those things were so good that as soon as this virus hit them, and, you know, with all the social distancing and taking all the necessary precautions during the summer months, they were able to open, you know, schools during the fall. And I just hope that people realize that these are the things that they need to keep practicing, and hopefully we don't run into any big issues later on.
And speaking of hygiene and social distancing, we are going to talk about that. How do you enforce that in your schools when it's time to go, you know, into the classroom, into the buildings, into the schools themselves? So we're going to take a quick break and be right back.
The Back to School Town Hall is a presentation of Chris 6 News and has been brought to you by the law offices of Herman & Herman.